schools reopen in other states and then shut down again in Georgia and elsewhere because of the coronavirus outbreaks. Do you think schools should shut down if they have an outbreak? And if so, should every family be preparing for distance learning?
That parents deserve a choice, and if a parent believes that distance learning is the right thing, then we think the parent should be able to have that choice honored. These are unusual circumstances. I've said personally as a parent, I'm very, very comforted by the data that shows, our kids are very, very lower risk for this than they are for seasonal influenza. At the same time, I think parents need to be able to make that determination, but I also think it would be really bad policy to deny those many other parents the opportunity to resume in-person instruction for their kids. And so I think school districts, because we understand how important it is, and this is obviously just one aspect of it, social development, academic development, all these other things. And so, I think that the school districts, and I've been able to talk to a number of superintendents who have already started this week, and I think they're approaching it very smartly. If somebody is on a school bus and they're ill, then you send them home. And if parents have a child that's ill, you keep them home. The good thing about, one good thing of having done all the distance learning, even though I don't think it was as good academically, is we are in a situation where, because when I was a kid, if you miss school, you miss school. That may set you back if you miss for a couple days. Well, now we have all this stuff. We were at a school up in Hillsborough County, public charter, and they have it being broadcast anyways. And so they're in person. They do all these precautions, but they're in person. Some parents have asked for the distance. And so if you are in person but you're sick, you stay home. Guess what? You don't miss a beat. You're there. So I think that they're very smart about being very forward-leaning on having folks who are symptomatic staying at home. If someone develops symptoms, removing them from school. But I think doing a more surgical approach like that makes much more sense.